You can start.
Oh, okay. I'm Susanna Mamlilawe, and my project is entitled Medicare, which is breaking barriers and building support. This project is a community-based mental health which promotes projects in Koforidua in the eastern region of Ghana. It aims to encourage a culture of seeking counseling and psychological support. Um, Problems are relevant issues which are mental health problems like depression, anxiety, substance abuse are very common in this particular district, which is New Japan South. And there is a stigma around seeking counseling and psychological support. Also, there is limited access to mental health resources in this very particular vicinity where I live. So this project will create awareness through social media, posters, and community events to raise awareness. Also, other events organized in the community over there, we will also go there to promote mental health discussions and support training, which will provide a community-led to better support mental health initiatives. There will be counseling surveys, establish accessible counseling service for community members to access. Also, project objectives are specific project objectives are increase mental health awareness among the young people and also reduce stigma and also encourage people to seek counseling. Um, Measurable is also tax participation in campaigns and events, also monitoring counseling and guidance and counseling service utilization. The time bond will be around 6 months. That will be the goal set. Targeted populations are people ranging from 13 years to 40, which include um, single mothers, boys, girls, etc. Most of the people in my community are JSS and SHS graduates, and others are also school dropouts. If you meet someone and you talk to the person, you want to get to know their, how do I say, educational background, that's what most of them, I can say 90% of them fall under this range. And also, the families structured in my community are mostly single mothers and divorcees. Few married couples also have issues of their own that they also need um, counseling or mental health support, which will be in Koforidua. Community description. They are about we are about 2,000 people in the community as at now, and it's a very fast growing community because people are relocating here and people are moving here, building houses here and there, and many are also dropouts and few graduates. And their source of income, some are some have learned jobs or handiworks, but yet they don't have financial support to implement it. So they just hang around and move around and enjoy themselves at bars. That leads to a lot of substance abuse. Even though there is a facility here, a healthcare facility, when I go there, I don't see anything, not even a poster or a flyer encouraging mental health. This also makes seeking help very difficult here. So this project will be implemented by the first month. We will create awareness through campaigns, social media, posters, and community events. Over here, usually they have homecoming projects. The people who sell drinks like Joy Daddy Bitter, they also come here to host their events and stuff like that. So over there, we can seek for, we can talk to them and they'll give us time to also advertise our project. This project, that we will use 3 to 4 months to train people to train people on mental health and also bring um, people who already have ideas, which are the counselors and psychologists who already have ideas about counseling, guidance and counseling, to train people in the community who knows the problem of some of these people who need help. So we'll give them little training where they will know how to counsel someone. Then further on, they will refer the person to a professional. It will also be established counseling services and support groups in the community. If we have support groups where they come together to share their problems and also to discuss and to support each other, it will also help in implementing mental health. Evaluation and implementation. We will monitor monitoring, which is tax participation and utilize survey for feedback. Through phone calls, we will take the numbers of participants and call them from time to time to find out what they like, what they didn't like, and how their counseling service is going. This impact will create awareness. It will also reduce stigma and improve access to mental health services. Sustainability, potential for replication in other communities. In Koforidua, most of the youth have this issue of substance abuse, the men in particular, and most of the girls also, they fall into depression and some of them into substance abuse. So if someday when we implement this in Koforidua and the Ada and other communities also see the impact, they might even invite us or we may even get more support to implement it in different communities in Koforidua. Thank you. That's all I can say.
Thank you, Susanna. That's a very interesting project you have there. And thank you for being very specific about the community you'll be reaching out to in the Eastern region. So currently you do live in a community, right?
Yes, please.
Okay. And then you talked about why you were interested in this project because you've seen you said there's drug abuse in
Yeah,
those areas. Okay.
exactly.
Um,
Yeah. I would say most of the people I grew up with, I can say about 70% of them ended up either being drug addicts, others are depressed, and there are some, excuse I don't mean to look down on them, but most of the girls are engaging in prostitution. And these were people I grew up with. But fortunately for me, somewhere along the line, I was relocated to Accra, where I
okay.
continue my high school. Yeah, that's where I realized I need to study hard, and yeah, I didn't fall into that.
Right. So
Yeah.
why do you think what is the basis of that? So mental health will not be the basis of that, but there might be a reason for what they are going through. So probably
Okay.
we can fuse that with the mental health awareness.
Okay. Over here, um, let me say it has become something that is a generational something. If children learn from adults. So it's like my senior sister when she completed, she was just there. She dressed up and go out at night. So when the
Mm,
person is either in the junior high or senior high, he or she don't see anything wrong with abusing drugs because she sees the other siblings doing that at home.
mm, okay.
Exactly. And it's like when we go out in the evening or even in the daytime, you will see those people who are supposed to be role models for the junior ones, they are drunk. And the guys, they go hunting on coconuts. When they get coconut, they sell. The person selling the coconut, you can tell the person has abused some substance and he or she is high
Mm.
automatically. Yes. And it's very sad.
So do you think it's because they don't have a job, which is giving them more time to go out there and do that? Um,
Um, I myself, I like using myself as an example. I don't have a job, but I
okay,
don't fall into abuse. I seek counseling and I seek guidance support. Lost my only sister last month, and I'm seeking psychosocial support. Yeah, even
okay,
today I had a section. So I realized the importance of mental health because of, let me say, a little educational background I have on mental health and psychology and stuff like that. But here are people in my community, they have little or no idea. The person don't know that when you are grieving, you need to seek support. The person don't know that when you are constantly sad or you have the urge to be smoking or be abusing a substance, you need to seek help. They don't know. They don't know. They don't know. We don't know. That's it. And
Okay.
even
So that
sometimes when I am in need of such help, when I go to the regional hospital, it's very expensive. Some
hmm
charge 200 Ghana for a section, 150 CD for a section, and we don't have jobs. So this is something that most of the people here they can't afford. Even if the person have an idea about it, it's difficult for the person to patronize the service because of the money involved.
Okay. So yeah, so the counseling services are also expensive.
Exactly. It's
Okay.
far in the regional hospital.
Hmm.
Yes.
Okay. Okay. Um, so what budget do you see for this project? Like how
Oh,
expensive do you think it would be
okay.
if you want to start a pilot project? Yes.
Oh,
What do you think your budget would look like?
okay. It's in my plan to motivate the participants in Ghana here. If you really want to capture the attention of people to participate in a project, you tip them. So
Hmm
it's also at the back of my mind that if people the participants, those who will be serious with their counseling sessions, who will participate fully, when they come, I will tip them something small on the daily basis. If maybe
Okay.
like 50 CD per person, as a
hmm
sign of motivation to motivate others to also participate. So when
Yeah.
I look at $2,000, yes, $2,000 would be okay. Within that 6 months, we will use some to pay. Yeah, how do I say? Yeah, that would be okay.
Okay. Um,
Yeah,
and do you already have like a team because you can't do this alone? Do you have people ready to
yeah.
volunteer with you or
Okay,
um
okay. I have the Actually, I started taking mental health, going for depression. I started taking therapy and other stuff at the hospital some years ago. So I've to build that relationship with some of the professionals. They are my personal friends. So if this project will be implemented, I will go to them formally and speak to them so that I will get help from them. And there are students who come under training at the hospital. Yes, they can also be of help. If the person comes and it's possible, we can give the person lunch as a sign of motivation, and also so that they use the participants as as their practical. Also, yeah, as their practicals to help them as well.
and so how do you plan to sustain this project? What is your plan to ensure sustainability for this project for the future?
Oh, okay. I work with other organizations. Yeah, I work with other organizations. So I'm planning on infusing. Okay, the organizations I work for, even though it's far different from what I want to bring to my community over here. But I'm planning on bringing this forward to those donors
Say that again.
so that if I'm planning on submitting this project and um, talking to other donors.
Okay,
Let me
okay,
break it. Let me break it down. Yeah, I
okay.
join some. Usually, I like joining like online mental health class for my own
hmm
benefit and stuff.
hmm
So in some of the classes, I tell them we have people in my community who can't afford data to come online to do this, but that, and some of them show interest, others don't. Yeah. So for now, I think after this one is implemented and the leaders in the community realize how useful or how important it has become and how the impact is, even if we're able to get 10 people to reform their lives through this project, the community leaders will support the chief, the assemblymen, yes, they will all join hands and support. Usually, that is something like that. They want to see you, how do I say, they want to see the impact before they join hands in supporting. So that was my plan.
What are the main challenges you would encounter in this project, and how would you overcome it?
Pardon me.
What are the main challenges you think you would face when you start this project, and how would you overcome it?
Okay. When I start, it will be difficult for most of the participants to open up because it will look new to them and they will see the reason why they need to open up to talk about their personal issues. But I've taken it upon myself to bring them on one level. I'll go to them individually and talk to them individually to motivate and encourage them to open up and see um, this opportunity as something golden because even if we are supposed to pay for it, most of us can't afford it. So we should make good use of this opportunity for a betterment of our own self. I'll talk to them one on one for them to open up and also embrace this project.
And can you walk us through, let's say, a specific activity or initiative within
Okay.
your project that has shown that you think, let me put it this simple way. Have you started anything similar to this project that has shown any success rate or success?
Yes, please. Um, yes, please.
Okay.
Okay. I have social. I'm an activist for intersex rights. Yeah, I'm an advocate for intersex rights and also an activist. So I go online and I see people going through issues. I don't know how to put it. And I create a safe space with my personal number, and they call me even at the wee night, and they
Okay.
talk about things they are dealing with that they can't tell.
Hmm. Okay.
Imaginary group in Ghana who are, let me say, whom the government is looking to criminalize, yet they exist in our community. I provide free space for them. They call me and we talk, and I help them out. You know, society is against you, your family is against you. It brings so much, a lot of them fall into serious depression. And here is the case, they don't know where to go. They find it very difficult to open up to someone because of fear of being stigmatized or being arrested. I use the little this that I have and I help them out by just sometimes hearing the person out,
Hmm.
being quiet, providing a safe place for the person to pour his or her heart out. There are some that are issues, childhood traumas that have been bothering these people for years. And they can't tell anyone because they don't trust anyone. And I've had cases where I'm not a professional, even though I learn from so many platforms. When I provide this safe place for them and they call me and they talk to me one on one, I see the impact I make in their life. I've been able to help someone who is so suicidal. He doesn't know who to talk to. This person was raped by someone they trusted in their family. And the person being a noble person, when he came out to talk, nobody would believe the person raped him. And he grew up to become um, a minority, part of the minority group. Yet we are still looking at criminalizing such a person. It's a whole lot. So I provide safe space for them and I help them out. The person sometimes the people they cry a lot. Usually when they start talking to me, some of them they cry by pouring their heart out and I just do that for them. And I see the impact it makes. Even though there are some I'm not able to refer them to um, how do I say psychologists for counseling because they are scared and they are afraid. But some are bold enough to accept uh, higher this higher
Hmm.
professionals than I am.